Okay, so this is chapter 8, cardiovascular system. Let's get to it. So for the structure and function, which is the beginning of this lecture, I'm going to direct you to another video lecture that I have on YouTube to go through the anatomy and physiology of the heart and the blood vessels. Okay, so we're going to get started right here. And this is slide number 9. So the main function of the heart, let me let Mark in. The main function of the heart is to pump blood. In your blood, you have hemoglobin, red blood cells, you have white blood cells, and you have platelets. The main function of hemoglobin is to transport oxygen to all your cells and tissues, and then to pick up carbon dioxide, transport it back to the heart so that you can expel it through the lungs, okay? There are structures inside the heart that prevent backflow of blood. I explain it like this. Your entire body is basically South Philadelphia because everything's a one-way street. If anything goes backwards, you have a problem. So to prevent backflow of blood inside the heart, you have valves. And there are 4 valves: the pulmonic, the tricuspid, the bicuspid, which is really known as the mitral, and the aortic valve, okay? There are 3 major types of blood vessels that you have, and I'll give you the function of each. The way I remember it, arteries carry blood away from the heart, A and A. Veins carry blood to the heart, and capillaries are basically where the arteries and veins meet. Okay, it's a closed system. And then which blood vessels contain valves and why? So only the veins contain valves, and they're one-way valves. Why? Because the arteries don't need valves. You have your heart pumping blood through your arteries. When your blood gets to the most distal portion of your body, which would be your toes and your fingers, there's no pumping system to bring it back to the heart. So you have valves in the veins because muscular movements, walking, breathing, any movements that you make help to propel the blood up through the valve, and then the valve slams shut. Propels it again, next valve slams shut, and it slowly pushes the blood back up to the heart. So you're fighting gravity, okay? You have 4 chambers in the heart. You have 2 atria, the right and left, they're the top chambers. And then you have 2 ventricles, the right and left, those are the bottom chambers. And the weird thing is that throughout your body, arteries carry oxygenated blood away from the heart, but the pulmonary artery does the opposite. Only the pulmonary artery and vein, they are the only ones that are different from all the others in your body. The pulmonary artery carries deoxygenated blood, and the pulmonary vein carries oxygen-rich blood. And then we're going to talk about the combining forms. So for heart, you have cardio or corono, like coronary, right, or cardiovascular. For the atrium, which is the singular form of the atria, is atrio. Ventricle is ventriculo. And the septum, and that's the wall that divides your heart in half, left and right sides, septo. Your veins, you've heard of phlebotomy, right? So phlebo, that's pertaining to the vein, or we can say veno. Don't confuse it with wine. Arteries would be arterio. Valves are valvulo or valvo. And electricity, oh, that's a terrible typo, would be electro. So the main function of the heart is to pump blood for the transport of oxygen and carbon dioxide. Oh, did we do this already? Yeah, we did this already. My bad. It's one of those days. Did that? Okay, here we go. Fatty plaque that can build up inside your arteries is called like atherosclerotic plaque. Comes from eating too much fatty food. Embolus would be embolo, and that is a foreign substance like a blood clot or something in your blood. Pulse is sphygmo. Think about it. A blood pressure cuff is called a sphygmomanometer. So that, you know, we're looking at the pulse and we're looking at the pressure of the blood through the arteries and veins. And then muscle would be myo. Narrowing right? Or a stricture of something would be steno, like stenosis. And then a blood clot is thrombo. Pertaining to across the septum, so across that dividing portion of the heart, would be transseptal. See how we put that word together? Trans meaning through or across, and then septal pertaining to the septum. Anything that gets destroyed is lysis. So if destruction of a blood clot would be thrombolysis. Pertaining to the ventricles, ventricular, and then tumor of fatty plaque. Fatty plaque is athero, and then a tumor is oma, atheroma. Something within a vessel, endo meaning within, vascular. Inflammation of an arteriole, and arterioles are tiny arteries, would be arteriolitis. The condition of having an embolus is an embolism. And if we're talking about something pertaining to the muscle of the heart, myocardial. Narrowing of the aorta, aortostenosis. Rupture of the heart, cardiorexis. And condition of a heart without rhythm. That doesn't mean it's not beating, just to be clear. I don't really like the way that's worded. It means it's not a regular rhythm. That is an arrhythmia, right? Because a means without. So it doesn't have a rhythm. It's all over the place like a jazz band. Enlargement of the ventricles is ventriculomegaly. Megaly is enlargement of, right? Ventriculo pertaining to. A slow heartbeat is bradycardia. Somebody tell me what's a fast heartbeat?
Tachycardia.
Thank you. Good. Tachycardia. And then the process of recording the heart is cardiography. Like electrocardiography is recording the electrical activity of the heart. And that's as far as I've gotten. So enlargement of the heart. Anybody?
Cardiomegaly.
There you go. Cardiomegaly. And then something that is resembling a pulse. So remember the pulse was sphygmoid, right? So that oid is like resembling. A tumor that's in a blood vessel. So what's the word for tumor? That suffix for tumor?
Oma.
Right. So a hemangioma is a tumor of a blood vessel. And then looky there, the condition of a rapid heartbeat, which we already did, would be tachycardia. Very good. All right. So now this goes into diseases and conditions, and I'll do my best with this PowerPoint. Like I said, I'm not a big lover of it, but so arteriosclerosis, arterio pertaining to your arteries, sclerosis, right? It's a breakdown or damage of. So this is something that happens to people. They also call it hardening of the arteries. You'll hear like older folks call it that. It's something that's progressive and degenerative. And usually it's caused by fatty plaque. So people with high cholesterol will wind up with arteriosclerosis in addition to atherosclerosis, but it can also come from age, right? Sometimes it affects the coronary arteries first or the carotid arteries. They're the two arteries that feed most of the oxygenated blood to your brain, the ones that are in your neck. And it causes basically a loss of elasticity of the artery. Sometimes blood clots can form, and if they form, they can move. And if they move, that's bad. They can cause a stroke or a heart attack. And basically, it's a very dangerous condition. Excuse me. Signs and symptoms. If it's the carotid artery that has arteriosclerosis, you're not getting enough blood flow to your brain. So vision issues, dizziness, confusion, headaches, stroke symptoms, slurred speech, those kinds of things. If you have arteriosclerosis in one of your coronary arteries, that is angina. So in other words, you'd have chest pain, shortness of breath, palpitation, possibly, and weakness. Excuse me 1 second. Stop it. Sorry. And then peripheral arteries, in other words, the arteries in your legs, can cause claudication. So there's something called intermittent claudication, which means that sometimes because of arteriosclerosis, people will have this intermittent pain when they walk. It'll come and go. Okay, so that's intermittent claudication. And what's the treatment? Well, I mean, the treatment, the prevention, which is better than the treatment, would be don't let your cholesterol or triglycerides be very high. Watch what you eat. But we can also give you medications, of course, to decrease your blood levels of cholesterol and triglycerides. We can give you anticoagulants to control the blood's ability to clot. And then if it's really bad, we can do a surgical intervention. Endarterectomy is something that we do to the carotid arteries. And that word is a mouthful. Endarterectomy. A carotid endarterectomy is what we in the business call a roto-rooter. Basically, the surgeon will go into the carotid artery and kind of open it up, scrape it open to open it up. Cardiovascular surgery, like a cabbage, which is a coronary artery bypass graft, or we can put a stent in, and a stent is basically kind of a little tube made of mesh that goes into an artery to hold it open. So here's some little case studies. Mr. L has dizziness, confusion, and weakness on the left side of his body. Ultrasound of his carotid artery shows blockage by fatty plaque. This condition is, anybody? Come on.
Arteriosclerosis.
Thank you, Ashbal. Yes, arteriosclerosis. We'll use blue. That's prettier than yellow. Mr. L will undergo removal of the plaque buildup from his carotid artery, a surgical procedure called, come on, kids.
Endarterectomy.
There you go. Thank you. Thank you, Ashbala. It's an endarterectomy. And then Mrs. J underwent ultrasound of her carotid arteries. This test revealed minimal plaque in her left carotid artery. Her doctor explained that an excessive buildup of plaque on the carotid artery may cause
a stroke.
There you go. Yeah, there you go. At least we had one other person besides Ashbala, so thank you. All right, now we have coronary artery disease, CAD. So it's a disorder where the coronary arteries, they're the little teeny tiny arteries that feed oxygenated blood to the myocardium. This is the left coronary artery, which goes to the left anterior descending. That's called the widowmaker, fun fact, because if that part of the left coronary artery is occluded by either, can be because of high cholesterol, atherosclerotic plaque, then that part of the muscle of the heart is not getting blood flow. That's the left ventricle right here. That's the one that has to pump oxygenated blood through the aorta here into your body. So it's called the widowmaker. That one's occluded. You're probably going to die. If it's partially occluded, we can do bypass surgery, depending on how bad the ischemic condition is. Ischemia means not enough oxygenated blood. So coronary artery disease, if they have a total or almost total occlusion, then the tissue is going to die. That's an infarction. So when we say someone had an MI, they had a myocardial infarction, that's a heart attack. And it's because of death of that part of the myocardium that didn't get oxygenated blood. So most commonly caused by arteriosclerosis, also can be caused by a clot, right? Rupture caused by plaque, not as common, right? It's usually because of high cholesterol, high triglycerides, or a blood clot that actually either formed there or one that started someplace else and moved and traveled there. Risk factors: smoking, stress, physical inactivity. Sitting is the new smoking. Family history. So if you've got a family history of CAD, it doesn't mean you're going to get it, but it certainly makes your risk higher. Diabetes, obesity, and elevated blood cholesterol and triglycerides. I'm going to throw that in. And the signs and symptoms, and fun fact, when women have coronary artery disease, they're more likely to die of a heart attack. Why? Because they blow off the symptoms, kind of ignore them, thinking that the symptoms are something else. And, they wait usually too long to go seek help. So the signs and symptoms, anginal pain, that's chest pain, right? Shortness of breath. Diaphoresis. Does anybody know what diaphoresis is? Anybody know that one? Remember diaphoresis? Anybody? Come on. No. That's sweating. Okay. Diaphoresis is sweating. And pallor, kind of like it sounds, means you look white as a sheet, white as a ghost. All the color has been drained out of you. And so treatment, lifestyle changes, quit smoking, stop eating McDonald's, get some exercise, weight management, stress management. We can control your angina, say with vasodilators like nitro. We can control your hypertension with ACE inhibitors, angiotensin receptor blockers. Triglycerides and cholesterol can be controlled with niacin or statin drugs. And anticoagulants like warfarin are typically used to prevent a blood clot from, reforming. And then the surgical interventions, there's the CABG that I spoke of earlier, coronary artery bypass graft, and that's open heart surgery. That's where they slice open your chest. They take a saw and saw open your sternum, and they take a vessel from your leg, usually, harvest the blood vessel from your leg, and graft it onto the myocardium so that we can restore blood flow to the part of the heart that's been deprived of it. There's also percutaneous transluminal coronary angioplasty, and that's more of a repair. I'm not going to get into that. Anybody that goes on to nursing, you'll hear about that later on. So Mr. T has chest pain that radiates to his left arm. He's pale and perspiring profusely. An EKG reveals necrosed heart tissue. His diagnosis is, what's going on? Is he having fibrillations or an MI or palpitations? And remember, MI is myocardial infarction.
Myocardial infarction.
That's the one,
A
Ayana.
heart attack.
Haha, good girl. All right, let's highlight that one. All right, next. Mr. X is diagnosed with CAD. The doctor tells him that lifestyle changes could reduce the risk of further heart complications. These changes include exercising regularly, losing weight, reducing stress, and maintaining a diet low in saturated.
The fats.
That's the one. You want to stay away from saturated and trans fats. They're the ones that will kill you. Anybody that's ever cooked bacon in a pan and then let the pan sit there, and you know how the grease just kind of coalesces and gets hard? Yeah, it does that in your arteries. A 50-year-old male arrives at a clinic complaining of pressure and pain in his chest. After a brief exam, the doctor concludes his symptoms are the result of a decreased blood flow to the heart muscle, resulting in decreased oxygen, which is a condition called, what is it when there's not enough oxygenated blood?
Is it ischemia?
One. Ding, ding, ding. Johnny, tell her what she's won. A new car. Okay. Now we'll talk about aneurysm. An aneurysm is a outpouching. I'm going to explain it my way. It's a weak spot or outpouching in part of an artery. Okay. And what can happen, the most common ones are either in the brain or the abdomen. So if you have an aneurysm in your descending aorta, they call it a AAA, an abdominal aortic aneurysm. If you have an aneurysm in your brain, it's a brain aneurysm. And the problem with the brain aneurysm is, remember, arteries are under pressure, right? Because every time your heart beats, it's pumping the blood through the arteries. That weak spot can balloon out, get bigger, and then rupture. And if it's in your brain and it's a bigger artery, you'll be dead before you know it. You'll just say, I've got the worst headache I've ever, boom, dead. If it's a AAA in the abdomen, oftentimes they are found by accident. A patient will go into the ER, maybe for abdominal something, abdominal pain, or for some other reason, pneumonia even. And when they do an X-ray, the radiologist will find it and say, hey, oh, by the way, this patient has a AAA. And so then we're going to watch it and make sure that it doesn't get bigger. And if necessary, we can do surgery to repair it before it bursts. Because if that one bursts, also dead before you can say, well, my stomach and lower back hurt, boom. So there are three main types. I'm not even going to get into this. Don't worry about it. So it's the shape of them that matters. This is not something that you need to know just yet. Signs and symptoms, I already talked about it. When people are super skinny, sometimes they will feel a pulsation or even see a pulsation in the abdomen, right? If they get to these symptoms, sweating, tachycardia, hypotension, tachycardia and hypotension are signs of hypovolemic shock and death. So that means that it's ruptured. So it's too late. Treatment, I already talked about it. You know, we can do surgical treatment, a graft. We can do a stent. We can do what's called a clipping. Brain aneurysm, only time you will see surgery done. Usually brain aneurysms are asymptomatic, so the patient doesn't even know they have one until they get that worst headache they've ever had, and then they keel over because they, you know, it's ruptured. But the brain surgery obviously carries a lot of risk. So we're not going to operate unless it's, you know, ready to blow and we know it's there. Very rare. An aneurysm may cause weakness, sweating, tachycardia, and low blood pressure, which is known as.
Hypotension.
There you go, Ayana. Thank you. And during a physical exam, the doctor palpates a pulsating mass in the patient's abdomen. This sign is characteristic of.
Aneurysm.
Ayana again. All right. Are you the only one here tonight? Did everybody else take a powder on me? Thank you, sweetie. Mr. B's doctor advises him he has an abdominal aneurysm. The doctor explains it's likely the cause of his episodes of a very rapid heartbeat called, what is it when your heart goes really fast?
Tachycardia.
There you go. All right, more than Ayana here. Very good. Thank you. It's tachycardia. During surgery, the surgeon discovers a spindle. No, don't even worry about that one. Next. Oh, varicose veins. This is a fun topic. So varicose veins are these like twisted, enlarged veins, and they come from bad valves. So some people have them genetically. Some people get them just because of age. But a valve has gone bad and the blood will backflow. Remember, it's not supposed to go backwards. And it'll pool and get enlarged. So if you've ever seen anybody with varicose veins, usually they'll get them on the legs. You can have them anywhere, right? But the legs are the most typical. And it's just a vein that has a bad valve in it. They can do surgery to repair it. Sometimes if it's a small vein, they'll just ablate it. In other words, they'll go in with a laser and destroy the vein, right? Lower legs, right? Esophageal varices are not common. So again, another issue that I found with this. Esophageal varices are varicose veins within the esophagus. Usually they happen to people with liver disease secondary to alcoholism, and they are very dangerous because they can rupture and you can bleed out right through your esophagus. So you'll be throwing up blood. Rectum hemorrhoids, that's common. And, you know, people that are pregnant women will typically towards the end get hemorrhoids. They're painful. They're just varicose veins of the rectum. And men that do heavy lifting, that kind of thing, will sometimes suffer from hemorrhoids. They are no fun either. Signs and symptoms. There's a good picture. That's what they look like. They're these twisted, bumpy, lumpy veins, usually in the legs. Sometimes they hurt. Sometimes they don't cause any pain. It depends on the size of the vein. If there are lots of them, the patient can then wind up with edema and ulcers, because if the blood flow is, constricted from getting back up above this area, then they're going to get retention of fluid and blood in the lower leg. And then that would be edema, and your skin will only stretch but so far, and then it will start to weep. That's where the skin ulcers come in. Treatment, lifestyle changes. You know, if you have to stand, you're better off kind of moving around, going from one leg to another rather than standing for long periods of time. Elevate the legs because that helps gravity assist with the blood flow to return back to the heart. Compression stockings, they're also called TEDs, help also. And then, like I said, there are surgical procedures. With each of her 4 pregnancies, Mrs. M noticed an increase of pressure in her varicose veins. She now complains of pain that's not relieved when she elevates her legs or uses compression. No, we're not going into that one. My bad, skip. Let's see. All right, so Mr. G, 87-year-old patient, has a history of vascular problems, dependent edema. So that's that edema or swelling that happens because the valves in the veins are insufficient. So when he's standing, the fluid just accumulates. He developed skin ulcers on his lower legs. His wife said, what caused them? And the nurse says, well, they're a complication associated with
Varicose veins.
Thank you, Mark. Thank you. Varicose veins, absolutely. Okay. All right. So now we have some words. So I'm going to ask you guys to play along. What's an arrhythmia? Somebody. Arrhythmia. A.
Irregular rhythm.
There you go, right? So technically it means without rhythm, but it means that the heart doesn't have a normal rhythm. It's out of rhythm, right? So it's also called a dysrhythmia, which is actually the more common, right? That's the more common word, dysrhythmia. Those 2 words are interchangeable. It just means that your heart is not like a marching band, lub dub, lub dub, lub dub. That's what your heart should sound like. If your heart is a jazz band, lub dub, dub, that's bad. Only good for a jazz band, not good for your heart. Embolus. What is an embolus?
Blood
A
clot.
blood clot.
Yeah, it can be a blood clot. It can be an air embolus. It can be a fat embolus. Yep. So basically it's something foreign. It's a foreign object that is in your blood, right? Gets lodged in a vessel. Okay. Foreign object in blood vessel. And then hypertension. That's an easy one.
High blood pressure.
Yep. It's high blood pressure, high BP. Exactly. And what is an infarct? So a myocardial infarction, right? So what's the infarct part?
Dead tissue.
Right. So that's the tissue that's been damaged or killed because of not enough blood flow, right? So necrotic tissue due to what? Ischemia, right? Because ischemia is, insufficient, oxygenated blood flow. Very good. And then what's a stent?
It's like a tube to replace a vein.
Right. So it's a small tube that usually into an artery, right? So it's a small tube that goes into an artery to kind of open it up to let the blood flow the way it's supposed to. There we go. And then cabbage. Okay, so like I said earlier, with a cabbage, I basically already explained this, but we'll go over it briefly. If this artery is blocked, and this is a nice little picture here, let me make it a little bit bigger. There we go. Okay, so left anterior descending, remember that's the widowmaker. And there's a blockage up here in that left anterior descending, which is underneath. This thing right here is a blood vessel that was harvested from another part of the body, usually the leg, and grafted from here down to bypass the blockage and restore blood flow down here, right? So that's what a coronary artery bypass graft is. Everybody calls it open heart surgery. It's a cabbage, not like the cabbage that you eat. Percutaneous transluminal coronary angioplasty, just for fun. It's a balloon catheter that gets placed into the artery. And when we inflate the balloon, it actually opens up the artery. And then inside of it is a stent that stays there. So we take the balloon out and the stent stays in place. Okay, so this guy had a bypass to bypass a blocked segment in his coronary artery. And one end of it was anastomosed. So an anastomosis is connecting two tube-like structures together. Here we're talking about arteries. What kind of bypass surgery? What is bypass surgery called? What's that abbreviation?
Cabbage.
It's a cabbage. Very good. Coronary artery bypass surgery. This guy has CAD, and the surgeon proposes an endovascular procedure with a balloon catheter to restore blood flow. This procedure is known as?
Angioplasty.
Good job. Good job. Yep. Angioplasty. And Mr. W scheduled to undergo balloon angioplasty. So he's having a PTCA, and that's an abbreviation for, that mouthful, percutaneous transluminal coronary, pertaining to the heart, angioplasty. Okay, let me make this a little smaller again. Carotid artery ultrasound. So we can do an ultrasound to see if there's a blockage in the carotid arteries, because that if there is, even a small one, better to address it sooner rather than later. You know, don't wait for the stroke to happen. There's the endarterectomy. And so what we do is surgically, we go in, make an incision in the carotid artery, and basically go in and remove the plaque. It's like a roto-rooter, scrape that plaque out so that it opens that artery back up to restore blood flow to the brain. Okay, let's see. Ms. R had a little stroke. Her doctor's concerned about plaque in the carotids. To evaluate it, he schedules an imaging procedure that uses sound waves, and that procedure is called?
Ultrasound. Ultrasonography.
There you go, ultrasound or ultrasonography. Absolutely, very good. Thank you, honey. And then Mr. J underwent several tests indicating excessive amount of plaque in the right carotid. Fearing the patient may experience a stroke, the surgeon proposes to remove the plaque from the interior carotid artery, a procedure called, somebody say it.
Endarterectomy.
Thank you, Ashbala, an endarterectomy. That's a fun word to say. Miss L complains of symptoms associated with a stroke. After the workup, the doctor diagnoses her condition as hardening of the carotid artery and proposes implantation of a device to hold the vessel open. So a little device that's a tube that holds the vessel open is called a
Stent.
Thank you. ECG, EKG. Understand that those two are interchangeable. They both stand for electrocardiography. It was a K for many years because it was found by a German doctor, and Germans don't have C's, they have K's in their language. So it was electrocardiogram with a K, but both of these, initials mean the same thing. And that's a test where we put these little electrodes on your chest, and then we're looking at the electrical activity of your heart. And there's a very specific rhythm that we're supposed to see with very specific types of electrical activity. And that helps us diagnose different cardiac problems like heart attacks, MIs. A Holter monitor is just a 5-lead. So a regular EKG or ECG is a 12-lead. A Holter monitor is a 5-lead that we put on a patient, like they go home with it. They can be on it for like 3 days, sometimes 2 to 3 days. And, sometimes they're complaining of something, but we're not seeing it when they come into the office on the EKG. So we send them home with the monitor to see, hey, what's going on. Then there's a stress test. And a stress test is either an exercise or a drug-induced one. So patient gets on a treadmill if they're physically able to. We put a blood pressure cuff, a pulse ox, and EKG on them. And we have them start out by walking, and then they walk faster. And then the idea is to put stress on the heart. So if you're jogging or running, your heart has to beat faster to pump oxygenated blood. That stresses your heart out. So we're looking to see if there are any electrical changes when you're running. Now, if you can't run, So you have bad knees, you're older, whatever, we can do a drug-induced stress test. So we can give you medications that will almost mimic you running. It'll increase your heart rate, and then we'll be able to watch the EKG and look for changes. So here you go. What is the test that checks the electrical activity of the heart? What is that called?
EKG.
EKG or an ECG. It's an electrocardiogram. Cardiogram. Very good. And to confirm the diagnosis, we're putting this Mr. X, we're sending him home with a little portable EKG system. What's that called?
Holter monitor.
A Holter monitor. Some physicians call it a event monitor. So just so you know, they mean the same thing.
So is it EEG for the brain?
Yes, it is. That's an electroencephalogram,
Okay.
right? And an echocardiogram is an ultrasound of the heart. So there's no shortcut for that. You have to say an echocardiogram. Okay, some people think that that's ECG. It is not. An electrocardiogram is an ECG or EKG. Echocardiogram is an echocardiogram. And an EEG is for the brain. All right, let's see. This gentleman is going to have an ECG taken while he's exercising on a treadmill. And we call that a
Stress test.
Yep, stress test. Absolutely. Very good. And implanted cardioverter and defibrillator. So there are different electrical rhythms or dysrhythmias, I should say, that your heart can go into. Typically speaking, atrial dysrhythmias are benign. They're not going to kill you. But ventricular dysrhythmias, like for example, when someone's having a heart attack, they go into ventricular fibrillation, typically. The heart, so fibrillation, the heart is just jiggling like a bowl of jello. It's not pumping, so they don't have the pulse, okay? So for some people that have chronic issues, we can put a defibrillator implanted in their chest. And I've seen, if you've ever seen one go off, I've seen one go off multiple times, different patients. It's like somebody just punched them in the chest, boom, because that's basically what it's doing. It's shocking the heart to kind of shock it back and hopefully into a normal rhythm, okay? And that's called an ICD for short. A procedure called a cardiac catheterization is where we put a catheter usually it's into an artery, not a vein, and it's usually the femoral artery, which is, you know, right here. And we feed it up into the heart while we also have an IV going with contrast dye. And what we're doing is we're looking for problems with blood flow through the coronary arteries. So oftentimes we'll be doing a cardiac cath and the patient is awake for this procedure. And we will find a blockage that's 30% or less in one of the coronary arteries, and we can put a stent in right then and there on the table. If the blockage is greater than 30%, the patient probably needs a cabbage, and we will get them out of the cath lab and schedule them for surgery. Coronary angiography, and again, it's basically, that's what we do during a cardiac cath. It's, you know, we're looking at the coronary arteries. And fluoroscopic guidance, in other words, while the patient's on the table under an X-ray machine, we're looking at the dye going through the arteries. Is it just flowing right through, or are there obstructions or stenosis or blockages or blood clots there? That's what we're looking for. Okay, so Mrs. N's got defib. To treat it, they implant a device that's going to shock her heart, and this device is called, or the abbreviation for it is, it's an ICD, right? Implanted cardioverter or cardioverter defibrillator. You can think about this one on your own. How would you explain? See how I just explained cardiac cath? How would you explain that to a patient? That's what they're asking you to do here. Let's see. Mr. S has a slow heart rate, and that term for that is
Bradycardia.
bradycardia, right? Too slow. And Mrs. X is going for a radiological procedure to evaluate her coronary arteries, and that is called coronary. I'm going slow.
Angiography.
Angiography. Thank you, babe. Very good. All right. And so recording the electrical activity of the heart, it is an ECG or an EKG. They mean the same thing, which is an electrocardiogram. And the process of recording that activity, right? Electrocardiography, right? There we go. We're almost there. Venography, really? No. Aortography, we're going to skip that slide. So recording the arteries of the heart, and we just talked about it, is angiography. And then if we have to surgically repair one of the valves in your heart, and the most common ones would be the mitral valve, that's actually the most common, and or the aortic valve. And if we have to fix it, we're doing a valvuloplasty, right? Pharmacology? This is interesting. No, wow. All right. You guys are getting a break because I can't see the value of going through trying to teach you a crash course on cardiac meds. I don't dig it. So we're done that.